Here on 12 News, and this morning we're taking a closer look at this new study that is challenging the way parents and doctors think about screen time and our kids. So research published in the Journal of the American Medical Association found kids who showed signs of addictive social media use were up to 3 times more likely to experience suicidal thoughts, depression, anxiety, or aggressive behavior. In other words, it's not just the screen time, it is the screen dependence that may be a real mental health risk to our kids. Okay, so that leaves parents wondering, right? How can we tell the difference between a kid who just loves to game or chat with their friends and one who is developing a problem?
So this morning we're sitting down with Dr. Carla Allen, who leads the psychology program at Phoenix Children's, and she's clearing some of these things up for us because this is a tough spot for parents because a lot of times you're just like, oh, I don't know what to do.
Yeah.
You know, like,
and this is the only thing.
They're bored, they're throwing a fit. Here you go. Just, basically be quiet. It's a tough spot. It's a tough balance.
It absolutely is. And I think what this study really demonstrates to us is that we want to make sure we're setting up a good structure for in-person things to balance that out. And this study followed kids who were 9 and 10 years old over 4 years, and so kind of younger, certainly to be exposed to social media and unlimited video game time. And so I think just trying to place limits and have some healthy relationships with tech, both from the parenting level, but the whole child, whole family.
Yeah, oh my gosh, we see that a lot. It's like the kids will follow the behavior their parents model, right? And so sometimes even, we're all guilty of being on our phones a little bit too much because it's changed so drastically over the last 10, 20 years. We didn't have phones like this, right? And now your whole world is in it. Your wallet, your banking, your, all your responsibilities, your doctor's appointments, everything is in the palm of your hand. How do you get them then to be better? I guess it starts with us.
I definitely think it starts with us. And, there really need to be no screen zones and times of day within everybody's family,
okay,
right?
That's a good tip.
Never at the dinner table for you or for them either. Not at bedtime. We don't want to show them that that's how we emotionally regulate either, because those kids are the ones who are at greatest risk of having that compulsive behavior, right? It's the quality of use, not just the quantity. So if you're using it to numb those emotions that are difficult, if you're using it to entertain yourself, if you're using it instead of doing homework or other things like spending time with friends, then you got a problem.
So then when you have a child that's addicted to this stuff and you as a parent, I guess, do you just take it away? Do you see a therapist? And then after you do that, what's, I guess, the rate of success that they actually kind of rebound and get back to normal?
Well, I think what I'd say is that, we need to look at this like any other addictive behaviors. You've got craving, you've got tolerance. I think this is the first time from a mental health perspective here that we're looking at it as something that requires real treatment. And so taking it away is actually likely to result in worsening of behaviors like it would.
And that's when you give it back.
Right. And so,
right.
Yes. Yeah. And so ideally, right, we create the structures and the replacement behaviors necessary, right? It's not like we're just going to take this away and you're going to figure out what else to do with your time. We want to build up, soccer time, time with friends, time with family, and then the structure about phone-free zones and times.
Yeah, I like that idea.
What about the video games where they're playing with other kids, with other people, and now there is some social aspect to it. Is that just as bad? Is that a little bit better?
Well, I think what we see here is that for boys who are in that high-use compulsive group, they have those similar sort of poor outcomes as girls who are addicted to the social media. So there's nothing protective about the video game aspect when it's compulsive. I think scheduling the time, making sure it doesn't run over other activities, that it's not a replacement, is what's really key. Prevention matters, right?
Prevention. And in some cases, this can start really young, too. We were just talking about, the rise in popularity of, social media pages like Miss Rachel. Kids love it. I have a cousin who swears that his daughter learned to speak so soon because she was so young when she was speaking. And he says, well, I think it was Miss Rachel. And there are a lot of parents who feel that way. But we know screen time is bad for kids that young, and you're seeing it even older. So what are we to do? Is there ever a good reason to give them, screen time?
I mean, the truth is, sometimes it's a tool for parents, right? We've got something to do, and we know it helps keep them safe. So I get that. I think the thing is keeping it in balance and remembering kids learn best from the people around them. Perhaps the secret sauce with Miss Rachel is not Miss Rachel. It's all the focus on early learning that those parents are demonstrating throughout the rest of the day with them, right?
Yeah,
so
that could be.
Again, it's that balance.
What would you tell a parent that's watching this and they're like, you know what, my kid needs help? What do they do?
Yeah.
Well, I want you to call, a psychologist, talk to your primary care physician about that. They can help with referrals. Treatment really, it helps. And the earlier we get it, the more likely those positive outcomes are to be.
Yeah.
Absolutely. Thank you so much. I mean, I feel like we could talk about this forever just because it's such a, it's not controversial, but there's just so many things that we're learning about it now that the studies are more and more coming out about the effects of this on our kids. And so I'm sure we'll be learning even more, and we'll have to have you back. Thank you so much for being here. We appreciate it.
Thanks.